Hi, friends. Welcome back to Unmasking with Cindy and Sarah. We're so glad to have you back with us today. We are wrapping up our first series on trauma. So today we are going to be doing a Q&A where we are answering some of the questions that you sent in to us, letting you know what's coming up next, and also going over the adverse childhood experience. So this will help be a marker for trauma to see where you're at, since we've all experienced trauma. Um, Cindy will talk more about that. And then we're also going to give some examples of how trauma can show up in children and adults. So be sure to follow us on Instagram, subscribe, and send in any questions that you have, like our page. We really appreciate all of the support. So we are going to have Cindy get started with our first Q&A question.
Sure. So, one of the first questions that I received about the series on trauma was on dissociation. Specifically, what is the relationship between trauma and dissociation? And I wanted to take this question because I recently went to a training about dissociation because it's something that I've always been curious about. I think there's a lot of misconceptions about dissociation, that we have to be highly traumatized individuals to dissociate. But in reality, dissociation is something that we all experience. In fact, I've probably dissociated a couple of times today. It's basically when your brain and your body just start to get overwhelmed in a certain scenario. So, if information is coming in too fast, or you have something else going on in your life that's taking your attention, you might start to dissociate, which basically is just the brain's way of keeping you safe and protected. And so it might look like kind of wandering off, daydreaming. Those are some of the more minor ways that we can dissociate. But if we've experienced trauma, both PTSD and CPTSD, or just isolated little t traumas, our dissociation might look a little bit more extreme. And so, one of the things that I talk with clients about if they come in with a lot of trauma is I want to understand what their day to day experiences are on a dissociative scale. So, for example, do you find yourself getting lost in conversation? Do you not remember how you got to certain places? Um, do you feel like you're outside of your body, looking at yourself, kind of maybe more removed, kind of void of emotion, just those types of things. And so I want to say the higher level of trauma, the higher level of dissociation. Um, but I think the most important thing for us to remember about dissociation is that the mental health community really, I think we've done a poor job with explaining dissociation. I think we've kind of used it as something for people to fear, um, that there's a lot of just untrue information about it. And so I'd like to spend some time just really educating people on the why. Why are we dissociating? Um, what is the purpose of it? And then what are some ways that we can bring ourselves back into the present moment by grounding, mindfulness, um, things like that. But I thought that was a really good question. Sarah, do you have anything to add on that?
Yeah, I was thinking, as you were saying that I have dissociated, and experience, when I've been in certain situations, but I have found that that has helped me in
Hmm.
certain situations, to protect myself from maybe doing something that, or reacting, like having a knee jerk reaction to something. For me,
Hmm.
it's actually been beneficial at times because I'm able to kind of like look outside of myself and
Yeah.
then come back and kind of calm myself. So I'm really glad that you're talking about the positive side of it as well, because I do think there is a fear that if you're dissociating, you are you're having a really traumatic moment. You aren't in a healthy place. It's scary, those kinds of things. And I think for dissociation, that it can also be kind of like setting a healthy boundary for yourself.
Hmm.
at times to protect yourself from something that maybe could be traumatic. So I didn't know if maybe you could give some examples of what that would look like.
Yeah.
From, I know you said like grounding and things like that, but how we can see it in an unhealthy way versus a healthy way.
Yeah, that's a great question to kind of be able to distinguish the two. So I am an EMDR trained therapist, and EMDR stands for eye movement desensitization and reprocessing, and it's a form of trauma treatment. So if I have a client that comes in that wants to do EMDR, I would first do like a trauma inventory. So I would want to know like what are some of the big things that stick out to them that were traumatizing for them. But then I always give them what's called a dissociation scale. And so there are just several questions that measure the I guess the extreme, like from the like least extreme to most extreme forms of dissociation. So for a lot of clients, it can feel really frustrating for them because they're losing concentration and they're not able to um, sustain attention. So it's really affecting them just in their workplace, in their relationships. They kind of check out pretty easily. They just have a really hard time even recognizing what's coming up in their body, how to pay attention to their bodies. So, very different from what you were saying, which is like, yeah, I have to sometimes in certain situations with certain people kind of mentally check out to keep myself safe and protected because that's not really a safe relationship for me.
Mhm.
So that would be where dissociation would be helpful,
Okay.
like I'm going to be here and I'm going to be present, but I'm not going to allow myself to get swept up in this, right? I'm going to keep my boundary pretty clear. But I think that's not what we're talking about when we're talking about dissociation related to trauma. So,
Okay.
does that kind of clarify the two different types of dissociation?
Yes.
Yeah, and I
So
think for grounding, just to answer that second part, we want to be able to teach people how to recognize when they're dissociating, right? So if they have a heavy level of dissociation and it's really affecting their relationships and just their personal life, we would do a lot of nervous system education. So, talking about like, what does it mean to feel safe and grounded versus in a fight, flight, freeze state? And so, there's lots of different activities that I use with clients to get them just kind of talking about, thinking about, feeling what it's like in their bodies. I use music sometimes,
mhm.
like listen to this song versus this song. What do you notice coming up in your body? So it's just a kind of a fun, I guess, non invasive way to get them to kind of understand, like, ooh, that makes me feel tight in my chest. Or I notice my heart starts to beat a little bit faster when this is going on. So just really learning how to work with it instead of tensing up against it, if that makes sense.
Okay. So I imagine a healthy thing that people could do at home with this
Hmm.
would be starting maybe a small meditation practice or doing
Yeah.
some somatic yoga,
Hmm.
things like that. And then in conjunction with, maybe journaling about when they feel dissociated. And can you elaborate on an example of what that would look like for someone in trauma? Um, if they were dissociating, would that be if they like encountered, a family member that had abused them, how that would present, or if, you know, they had something going on at work, like a work trauma, or they had been part of, like a car accident or something like that. Can you just elaborate on
Hmm.
an everyday life example of what that would look like?
Yeah, like how to work with
Mhm.
it, with the
Yeah,
dissociation.
and, like, what that would look like. Like, when you see clients come in, how does that present when they say they've dissociated? Does that mean they don't realize they've been talking to the other person, or they don't realize their body is reacting in a certain way?
Mhm.
Just so every day, so that our listeners, everyday listeners, can kind of get an example that don't have a mental health background of what
Yeah.
that would look like for them.
Sure. I think a lot of it starts with understanding what their relationship is to the emotion itself. So I have a lot of clients that will come in and we'll talk about anger or sadness or grief. And as soon as we start touching on that emotion, if they've had trauma in that area, like let's say that they have a lot of anger, but they were shamed for having anger. So they've learned to really dissociate when they get angry and they shut down and they just kind of check out. We would want to do or not do some time, spend some time um, letting them kind of get familiarized again with anger in a safe way. So what is our relationship to anger? So I might
Mhm.
use like a sand tray experience, which is, if you're not familiar with sand tray, it's just like using like objects and placing it in a sand tray to kind of represent like your relationship with that emotion. So just really getting the clients to understand that they have permission to get near that emotion and that it's safe to be near that emotion in little increments. But we have to start sticking toes in the water before we dive in to just being up close and personal with that emotion. So if it's anger, let's say that they are dissociating from experiencing, like anytime someone gets angry
Mhm.
around them, they just check out and freeze. We would want to spend some time figuring out how can we kind of practice distress tolerance when
Right.
anger comes up, right? So rather
Okay.
than shutting down, what would feel safe for you when anger arises? Again, still talking about boundary setting because a lot of these people have trauma around these emotions,
Mhm.
right? So we wouldn't ever want to force them to stay in a situation where they're feeling overwhelmed. But I think that's part of them understanding their threshold of when does it start to feel like it's too much? What boundaries would you need to
Mhm.
set if you're feeling that emotion um, and you're starting to get flooded? What boundaries might you need to set in order to safely still experience that emotion, but it not sweep you under? Yeah.
And I love that too because I think especially for CPTSD, which is more of the little that can be a lot of little T's and relationship issues,
Hmm.
I think that is extremely helpful, um, because you're gonna be in different relationships your whole life, and
Yeah.
things are gonna trigger you, and so you have to know what those emotions can do and how to protect yourself. So that dissociation is going to happen, but how can you start working on it from a healthy way and putting those boundaries up? And it seems very physical. So, like, that can be a huge indication is physically your
Hmm.
body is showing you what's happening. And that way, then you can start working on it from there. So, really recognizing physically what's happening to you, which I love because a lot of
Yeah.
times we think it's all
Yeah.
mental, right?
Carla, oh,
But it's
sorry.
coming out physically. No, no, you're good.
Yeah. Yeah. I was just going to make a reference to Carla's episode last week when she talks about taking the mask off and on and off and on. And that is the somatic work that I think a lot of therapists are starting to do, where we have to be able to practice taking it off in a safe environment and really feeling it so that we know when we can put it back on again and to take it off, right? So masking
Mhm.
really comes up for me when I think about that question. But yeah, we'll have to do some more episodes on dissociation because it really is a fascinating, understudied
Yeah.
topic, I think. But yeah, Sarah, I wanted to ask you one of
Yes.
the questions that we received was on trauma symptoms, and specifically, how do symptoms vary between children and adults? And I thought this was a great question for you to address since you work primarily with children. And so, could you
Yes.
talk a little bit about that?
Yes. It can present in similar ways, but also very different. So, when we're talking about adults, I'll start with them because then we'll go into the children. So, you're going to see adults that have been through a lot more trauma. They have more of those pathways in their brain that have, webbed up and those little, so now they're little nets that we need to undo because of all the different traumas. So for them, it can look very different. They can have lots of highs and lows. So that can be you're very depressed, you can't get out of bed. And again, let's look at it from a perspective of what have you been through? What have you experienced? Because I also just want to note before we get into this that Cindy and I are not here to diagnose anyone. You can look up
Right.
all this information in the DSM-5. But sometimes a lot of these symptoms will present like other things in the DSM, like depression or anxiety. But what we have found with trauma is you are more at risk, right, to have
Mhm.
depression, mood disorders, anxiety, personality disorders. And then for children, it can lead to ADHD. There can be other things going on that may not even be also related to any kind of trauma. It's just how your child's brain works or how your brain works. So we just want to put a disclaimer that even though you may have some of these symptoms, it doesn't mean that you have had like huge trauma in your life. And it also doesn't mean that you are diagnosed with, depression or a mood disorder, or, you have ADHD or anything like that. We're just, giving you how it presents for adults. So that can be, again, dissociation, like Cindy had talked about. Adults can do that, children can do that. And I have a good example that I'll share in a minute about children and dissociation.
Mhm.
It can look like excessive worry. It can also look like OCD. It can come up where you're obsessively compulsively doing things. Um, Hold on, Cindy, my child's in here.
That's
Can
it.
we so that can look like obsessive compulsive, and I'm not talking about OCD where we are just like, and it can be where you need to turn the light switch, you have like a ritual of how you have to do things, but it can also be where you're obsessive with certain things and you have
Mhm.
to do certain things, like you have to clean your kitchen like a crazy person before you go to bed. Like it has to be spick and span. Maybe it is that all of the clothes have to be put away. Maybe before you can study, you have to have everything organized. There's different ways you can look at OCD. I think a lot of people think of it as the classic where, you have to touch a light switch so many times, wash your hands so
Mhm.
many times, but that's not exactly the case, but that will be another episode. Physically, it can show up. I know you mentioned a lot about the physical symptoms
Mhm.
that go hand in hand. And that can be where you have, tummy aches a lot for adults, headaches. Headaches are a big one. Um, where maybe out of the blue, maybe you were, in a car accident or something and you have a lot of headaches, sleep disturbances, addiction. That's a big one for coping. We haven't touched on that, but a lot of people cope through, drinking alcohol, um, maybe binge eating. There's lots of different ways that people can cope because they're wanting that dopamine hit to feel better. So for adults, I feel like there's a lot of avoiding things. Adults can
Mhm.
avoid a lot of situations, or they can put themselves into everything and be so busy that they can never have any downtime because they don't want a moment to
Mhm.
relax. So there's a lot of different ways that it can present for adults. Now for children, um, it's a little bit different. So I want to first go with kids. They can become very anxious and clingy, especially if it's been like a car accident. They were in the car accident. They might feel scared to get back in the car. They could also be scared of something happening to their parents. Now, I will say, until about age 7, it's very common for children to have separation anxiety from parents. That's a sign of secure attachment, and that's normal. But where it becomes an issue is if it's affecting them, like leaving the house, um, having huge meltdowns that they can't even calm themselves.
Mhm.
Um, Other things that can happen for them are, regressing. Maybe they were potty trained and now they are wetting the bed again, having a lot of potty accidents. Um, they could be hyperactive. Again, these can all be things that go into other kinds of disorders as well, like ADHD, sensory issues, autism spectrum disorder. So it doesn't have to be trauma, but they do. That's why it's so hard sometimes with kids to diagnose, because you have to really get a good picture of their experience up to this point and what they've been through.
Mhm.
Um, but typically, what you will see is after a traumatic event, or like parents are divorced, and the child has to now go to 2 different homes. There could be huge meltdowns happening because that can be traumatic. Maybe they had a teacher in school who wasn't very nice to them, so now they're avoiding school. They don't want to go to school anymore. Um, they're saying they're sick. I have a lot of kids who come in and they have a lot of tummy aches. That's tied to anxiety. The anxiety is tied to, you know, maybe something that they've been through that has been traumatic, like I said, divorce, seeing an accident, witnessing kids see stuff on the news, school shootings. They get very
Mm.
nervous about that, and that's a form of like community trauma, right? Like you're seeing it, you weren't exactly part of it, but you're seeing it, and now you have to worry about that because you go into school, right?
Mhm.
So there's lots of different things. Loss of appetite's a big one, or eating again compulsively. They just want to eat and snack all day. Um, and then the meltdowns. I think meltdowns are the number one indicator that something is going on because there's a difference between a tantrum and a meltdown. So
Mhm.
a tantrum tends to be where, and look, some of this is just normal. Like 2 and 3 year olds are going to have tantrums. But a meltdown is different because a tantrum tends to be manipulative, right? Like if you give in to the tantrum, it stops. A meltdown is this child is hurting. There's a real visceral reaction to something that has happened for this child, and there is no calming them down. And those last a very long time. The child isn't calm immediately after, it takes a while. And I think of that with dissociation, right? So, one of the examples I have, based off of our conversation we just had, Cindy, about this is Inside Out 2. I think of
Mm.
if you've seen Inside Out 2, you know Riley, and there's a moment in the film where she just has a complete panic attack. And you see her kind of dissociated from herself of all of these thoughts running around. And she's just sitting there frozen. She cannot move. And she's telling herself all of these different things in her mind that she believes about herself. And I use that as an example of what a meltdown can look like. And this can present for kids with AS on the spectrum. They tend to have, autistic meltdowns. So those are real reactions to like a transition or something. And these kids are in a lot of pain. ADHD,
Mhm.
sensory seeking kids, they tend to have a lot more of these meltdowns. When it comes to trauma, you're going to see these as well. And that is just like Riley, right? She has that anxiety of feeling like she's not good enough. She wants to be friends with this group. But she doesn't think she's a good enough hockey player. There's all these different layers there.
Mhm.
Um, Plus she's, her friends are leaving to go to a different school. That's hard on itself, right? Those are her 2 friends. She's already had to transition from schools. So we know she's had a trauma, right? She's moved to a new area that's completely different from where she moved before. Now she's trying to make new friends. Her old friends are moving. Those are all little traumas, but they're big to her, right? They may not be catastrophic traumas, but they're big to her. So we see her dissociating in that moment. Um, and then when we finally see, like in her, I think of her brain, right? So I think she's living in that limbic region where we talked about the amygdala and the hippocampus. And that's where all of her emotions are. So that's where she is. And I feel like I was going to ask you this too, Cindy, before we continue on. Do a
Mhm.
lot of the dissociation and trauma, they live in the limbic region, right?
Yes.
So a lot of the ways that we can calm this, right, are by accessing that prefrontal cortex. But we cannot do that until we relax our body and we
Right.
recognize that feeling, like you said. So we need to.
Mhm.
So I love when you talked about one of the ways is maybe listening to music, seeing how the different feelings come up for you.
Mhm.
And is that what you kind of do in your work, is recognize that feeling so that when the feeling comes up in the moment of trigger, we are then able
Yes.
to recognize it, validate it, like joy
Mhm.
validated anxiety. And then she was able to kind of calm herself. And that's where in the movie for me, because I think as a parent too, watching it, you get emotional. Just anybody, because we've all talked to ourselves like that and we've all felt that way.
Mhm.
But I feel like that's the key to accessing that prefrontal cortex is first we have to honor our feeling and honor what our body's doing before we can ever access that. And I didn't know your thoughts on that with how you do your work with adults as well.
Yeah, I think what comes up for me is Name It to Tame It from Dan Siegel's work. And he talks
Love, love,
about
love.
like flipping your lid, right? So like you
Mhm.
like make a fist and your fingers fold over your thumb and your thumb represents the limbic region of your brain. And when we are activated, our prefrontal cortex goes offline and we're living in that limbic fight, flight, freeze region. So it's really hard. It's like somebody telling you to calm down when you're in the middle of like panicking and you're like, that's so not helpful because you can't hear them.
Oh,
So,
thank you. Thank you for that. Thank you for telling me to calm down. I didn't realize
right.
that's all I needed to do. Don't worry about it. Just
Take
calm
a
down.
breath. Take a
Awesome.
breath.
Oh, take a breath. I've got a breath for you. Here's a breath. No,
Here's a
I'm
breath. So
no.
teaching children, I was going to ask you too, Sarah. Like I think, for adults that come in, they're hearing this for the first time about the prefrontal cortex and then the limbic region, right? Like I remember getting a
Mhm,
lot of this psychoeducation when my kids saw a
mhm.
counselor, like learning about hugging your brain again, like when you've flipped your lid, how can we get back online with our prefrontal cortex so that we can regulate our emotions?
Mhm.
But practicing these skills when they're not dysregulated is
Yep.
so huge. It's so
Yeah.
huge to practice when you're not so that you can apply it when you are.
Yeah, and that's why I love Inside Out, and I love just how great it is about also moving along from, childhood to adolescence, all of that.
Mhm.
But yes, with children, I think our generation still was part of that group that, you were seen and not really heard for your feelings.
Mhm.
But these kids now, man, I mean, the elder, Gen X, elder millennials, we're all coming in hot and we're like, look, we need to help our children have more emotional awareness, but yet we lack that too. So we're learning it with them. And I
Yes.
love Dan Siegel, how you just said that work, because that's a great way to show children. And I do the hand model with my kids. And I love it because I'm showing you here like the little
Like the
uh
wrist part, forearm.
yes, yes, like where your brain stem is and all of
Mhm.
that right there. So you have your limbic region, your prefrontal cortex. And then right here, I love it because that's where all the implicit stuff happens in your brainstem, right? But if you think about it physically, your body's going to do what it wants to do.
Mhm.
Implicitly, you don't know it's doing that. Then that's going to connect right here, right? To all
Mhm.
of the feelings that you have and all of your emotions. Yeah. So this is going to be activated first. That's going to be a trigger to let you know this has now been activated. But we can't activate this and hug it until we recognize how to calm both of these down. And doing that in the middle of being upset is not going to work. So
Right.
that's where I think it's very important to validate the feelings and to talk about feelings and physically what you're feeling with your children and let them see you do it too. Like I always tell parents, we could tell children all day to behave a certain way or do something, but they're going to watch how we do it. So
Mhm.
maybe even saying, I'm really frustrated right now. I just need to take a deep breath. Like I need a
Yeah.
minute for myself. I need to take a deep breath. And let them see you do that in the moment because chances are they're going to see you do that multiple times and then they're going to eventually model what they see you doing. But if you are yelling and lashing out, but then you tell them, stop yelling, stop lashing out, they're going to be like, but you do that all the time.
Mhm.
Like how
Mhm.
like you're not modeling it for them. So I think it's really important, especially when I'm with my kids, and I see them as I work a lot with the parents too on how they can practice those things at home with their children in a state of calm before we get into being triggered. But yes, going back, I think the trauma definitely presents a lot like adults,
Mhm.
except children tend to have more of meltdowns. I would say more, adults, it seems like panic. For children, I think it's more of like a meltdown and it can present like an anxiety attack. That's a good indication. And I would say if you are concerned for your child with if it's really a tantrum is to look at the manipulation behind it. If you give in to your child with like what they want to do, like they want a toy at Target and you were to give them that toy and they calm down, that was a manipulation. But if your child is not calm, even and they are just out of sorts, the last thing I would do is try to reason with them in that moment. The
Mhm.
best thing you can do for your child in a moment with any of, and that doesn't have to be just through trauma, but any work, is to just sit with your child and to say, I'm here for you. And then later when they're calm, then go back in with your child and talk about what happened and what you can do next. But do not reason with them, because what you're going to have there is mirror neurons, right? So they're going to model whatever you're doing. Like,
Mhm.
so if you're angry, they're going to get even more angry, and it's just going to go back and forth.
Yeah.
And so there's no reasoning with these kids in that moment. And saying, I'm here for you. Maybe some kids are like, leave me alone. I don't want to be near you. All you have to say is, I'm here for you when you're ready. And even if you're sitting outside the door, because what you want them to know is you're not uncomfortable with the feeling they're having, right?
Mhm.
Like, you are accepting of their feeling. You're not avoiding their feeling. You're just letting them know they're there. So I think that is a way that you can kind of help them learn to relax their body from a dissociative perspective, but also to help with the trauma is letting them know that you validate their feeling, and then working from there to kind of help hug that limbic region and calm their body when they are calm.
Yeah, yeah. I love everything that you said. I can't wait to get into more detail about that in a future series, because I just think that there's so much psychoeducation that um, I was just sitting here thinking as you were explaining that, like, where was this stuff even 15 years ago?
I
This
know,
is
I
so new
know.
on the scene, and so we're
Mhm.
still learning. And what I always tell parents is that it's not so much about the rupture, but it's about the repair. And
Exactly.
speaking of repair, I I wanted to segue into our talk about the ACE study. So, the ACE study, just to give you a little bit of background about it, it's from the Center for Disease Control, Kaiser Permanente Adverse Childhood Experience Study. It's one of the largest investigations of childhood abuse and neglect and household challenges that affect later life health and well-being. And the original ACE study, it was conducted at Kaiser Permanente from 1995 to 1997. And they had two big waves of data collection. Over 17,000 health maintenance organization members from Southern California were receiving these physical exams, and they completed these confidential surveys regarding their childhood experiences and current health status and behaviors. You can read more about this, and we'll link all of this on this week's episode. But what they found was that the higher the ACE score, the higher chance of having health issues later on in life. So, disease, disability, social problems, addiction, leading to early death. And this study was really it was made up of 10 questions. And the 10 questions, I'll read them. We're going to link the ACE study as well. But just to give you an idea of what they asked these 17,000 people when they were conducting this study. Number one, and this is important because we're talking about the first 18 years of the lifespan.
Mhm.
Okay. So, first question: did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? And these are just yes or no questions, right? So, yes, this happened, or no, it didn't. Number two, did a parent or other adult in the household often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? Number three, did an adult or person at least 5 years older than you ever touch or fondle you, or have you touch their body in a sexual way, or try to or actually have oral, anal, vaginal sex with you? Number four, did you often feel that no one in your family loved you or thought you were important or special, or your family didn't look out for each other, feel close to each other, or support each other? 5, did you often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you, or your parents were too drunk or high to take care of you or take you to the doctor when you needed it? 6, were your parents ever separated or divorced? 7, was your
I love how
mother
you smiled on that one, Cindy.
I know.
We're both like, "Hey."
I know.
Sorry.
All these 80s children, right?
Mhm.
7, was your mother or stepmother often pushed, grabbed, slapped, or had something thrown at her, or sometimes often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit, or at least a few minutes threatened with a gun or knife? 8, did you live with anyone who was a problem drinker or alcoholic or ever used street drugs? 9, was a household member depressed or mentally ill, or did a household member attempt suicide? And then finally, did a household member go to prison? And so with these 10 questions, these are really heavy questions, right?
Yes, they
And you
are.
can,
Yes.
yes, you can look at this, and for some people it just can bring up a lot of emotion. But what I always ask people to do if I'm working with them, for EMDR purposes, who come with a pretty big trauma background, is add these scores up. And I can't remember the percentages, but I think it was like 30% of us have like at least a 3 on the ACE questionnaire. But if you have 6 or more, that can significantly change the outcome of your adult life. And so it's just saying that toxic stress harms children's brains, right? It can
Mhm.
prevent them from learning in a healthy way, connecting in a healthy way. And exposure to these childhood ACEs can increase our risk of adolescent pregnancy, alcohol abuse, depression, drug use, heart disease, liver disease, multiple sexual partners, intimate partner violence, STDs, smoking, suicide attempts, right? So, really understanding the connection between these two gives us the ability to have trauma informed care.
Mhm.
So, why is this so important? Well, because we need to understand how to then look at treatment, right? Giving people the proper care versus putting a band aid over it. And so, Sarah, I wanted to just pause there and hear
Mhm.
your thoughts about the ACE study.
Yeah, as you were talking about it, I was thinking too about how we also have to look at, race and cultural differences, which will come on another episode, but
Yeah.
how that can impact because having a higher ACE score is going to impact the opportunities that we have as well going
Hmm.
forward. And so, if you are from generational trauma, you have a high ACE score, you aren't going to be able, to have the same opportunities as someone else. It's
Sure.
just it's a harder road. Yes,
Hmm.
we all, people are resilient, there are protective factors, but I think the ACE score does a nice job of really looking at where you stand with trauma because all of them on there are trauma. Every single one of those questions is a trauma question. That
Yes.
if you the higher you have, guess what? You probably
Hmm.
are experiencing some CPTSD. And that
Yes.
also affects your relationships. It affects how, again, Maslow's hierarchy of needs. The more you have, the harder it is to reach self actualization. So I think the ACE score or the ACE study is the perfect catalyst to figuring out if you have trauma or not.
Yeah,
Um, it,
absolutely.
and it doesn't just have like you could have a 0 on it, but still have little traumas that happen. But these are some serious. I mean, these are traumas. Okay,
Hmm.
even
Hmm.
even if your parents are the nicest parents and you've been through a divorce, that's a trauma. Okay,
Of
it is. It
course.
is a trauma. And there are certain ages, and we'll get into that when we talk more about children, but there are certain ages developmentally that children are impacted more when
Hmm.
certain things happen. That can also go into that. But yeah, the ACE study, I think, is the number one study I would give anybody when it comes to
Yeah,
assessment for trauma.
absolutely. And I think what the Center for Disease Control was able to do was to really have this big movement towards trauma informed care. So
Hmm.
looking at how can we thread this into our healthcare system so that we
Hmm.
can be screening for these types of questions. Like if you go to the pediatrician now, they usually give the kids a tablet with questions to answer about depression and anxiety so we can
Mhm.
start tracking these things earlier on. And I wanted to say one last thing about the ACE questionnaire. Whenever I use this with clients, sometimes it can feel really discouraging to them and they can walk away going, "Gosh, I have a really high ACE score. Like there's no hope for me." But what I always tell clients is that if you have had some protective factors, that creates resiliency, which creates the ability to develop new neural pathways. And so we're also going to post a resilience questionnaire as well. So if you have a high ACE score, you could also have a high resilience score as well. And resilience trumps ACEs, right? So
Yay.
gaining, I know there's hope, gaining an understanding of this, helping children identify these feelings, creating these safe environments can allow us to break cycles. So that is the good news. I don't want to end on
Mhm.
a doom and gloom. It's all bad, right? So yeah,
Right.
we'll attach more info on that.
Well, and I love it too because if they're coming to work with you, Cindy, or they're coming to see if you're going to a therapist, you're getting your child therapy, you're
Hmm.
already ahead of the game. You're already a great parent. You're already
Yeah.
getting help for them. It's a lot of the protective factors I are amazing, and a lot of these kids do have it and their parents have it too, but we also I think it's good to note that even if you aren't in therapy, it's good to know the protective factors that you could have. And but if you are a parent, because I have so many parents that come in and they're like, I don't know what I'm doing. I'm like, you're not terrible. You're bringing your child into therapy or you're
Hmm.
coming in to work on your trauma. How amazing. How amazing that you are sitting here talking about the worst moments of your life with a person and wanting
Hmm.
to work on yourself. So I think, that is a protective factor in itself. So,
Sure.
I think that will definitely be something else we are going to go more into, have more of a positive episode on those protective factors.
Of course.
Um, well, is there anything else you want to add today, Cindy, before we kind of end our
I think that's
our
it.
trauma series?
Our trauma series. Yes, I really enjoyed I know that a lot of this stuff was really heavy and we kind of started
Mhm.
with a really heavy topic, but I think it was an important topic to start with to really dive into why we mask in the first place. So I learned a lot. And what are we thinking for the next unmasking, I guess, series or journey?
Yes. So, our next series, we've decided we are going to do, since it's that time of year, a back to school series slash
Yeah.
parenting series. And we'll have some guests coming in for that as well. But yeah, we are just so grateful for all of you for listening and learning with us and being on this journey. So, again, please feel free to like, subscribe, follow us on Instagram for new content. And we will link all of this episode's information below and also on our Instagram.
Thank you guys. Have a
Thanks,
great
guys.
week.
See you next time.
See you next time.